Hi everyone, my name is Leah Crown. I'm the Director of Health and Human Services for the City of Meriden. It is time for our weekly COVID-19 social media question and answer video. As always, thank you for your questions. And as I always start off every weekly video, we know that COVID-19 continues to be a rapidly changing situation. The answers to your questions today are based off of the Center for Disease Control and Prevention guidance, Governor's executive orders, as well as general disease knowledge as of today, May 27th, 2020. So our first question is, can COVID cause a positive flu test result, and where do we sign up to test for antibodies? For the flu test results, no, COVID-19 cannot cause a positive flu test result. Although both the flu and COVID-19 are both respiratory illnesses, they are caused by two different viruses. A person can, however, test positive for the flu, as well as other respiratory illnesses and COVID-19 at the same time. So antibody tests, we get a lot of questions about this. They are also called serologic tests. They are becoming more widely available through healthcare providers. This test checks the blood by looking for antibodies, which show if someone had a previous infection with the virus. Antibodies take about 1 to 3 weeks to develop after infection. This test is not for diagnosing current infection with COVID-19. We do not know yet if having antibodies to the virus that causes COVID-19 can protect someone from getting infected with the virus again, or how long that protection might last. There continues to be questions regarding the validity of the test as well, and scientists are doing studies to answer those questions. If you are interested in getting an antibody test, we recommend that you reach out to your primary care physician to see if you are eligible for the test. Our second question is, I am asymptomatic. How would I know if I had the virus? So it's a little bit related to question number 1 regarding the antibody tests. The only way to know that you have had the COVID-19 is if your doctor orders you an antibody blood test. The guidance on these tests is changing rapidly, and the CDC states that serologic tests, or these antibody tests, should not be used at this time to determine if an individual has immunity. We do not know yet if someone can be reinfected with COVID-19. Our strong recommendation in public health is to continue to social distance, wear a face covering out in public, wash your hands frequently, stay home if you are sick, monitor your health, and clean and disinfect frequently touched surfaces often. Number 3, how is Meriden doing in flattening the curve compared to the rest of the state? So one good thing that came out of COVID-19 is that all local health departments and districts, we are following the same guidance documents from the CDC and the state health department. However, local resources are very much different. That includes staffing and our funding to combat the pandemic. When I looked at other cities comparable in population to Meriden, and this included West Haven, Bristol, Hamden, Manchester, and New Britain, our current case count as of May 26 is 744, and that is actually slightly lower than the average of 804 for the towns that I just messaged. All town-by-town data is available daily on the Connecticut State Coronavirus website, and it's usually released anywhere between 2 and 5 o'clock. Number 4, will it be okay to have a party in my yard in July? So right now, until June 20th, per a governor's executive order, social and recreational gatherings should be limited to no more than 5 people. It is unknown right now if this will be extended past the June 20th date. Because guidance on COVID-19 prevention really changes daily, we cannot provide guidance for events in July at this time. Limiting face-to-face contact with others is the best way to reduce the spread of COVID-19, since we know that those without symptoms can spread the illness onto others. If parties and picnics with more than 5 people are given the green light by the governor after June 20th, we still recommend during these events to wear a face covering, social distance at 6 feet, wash your hands frequently, and having those over age 65 who are considered to be a vulnerable population stay home. Number 5, when can we take our mask off if we have plexiglass in front of us at work? So not knowing where work is, I hope that this answers your question. So the governor has set reopen Connecticut rules for different sectors that are scheduled to open in phase 1, which happened on May 20th. If you work in an office in a setting where there are segregated spaces such as cubicles or walls or private offices, employees may remove your masks. However, workers shall wear a mask or face covering from the time they enter the building until the time they arrive at their cubicle or workstation, and at any time they are leaving their workstation and moving around in common areas, such as in the hallways or the stairwells, or going to the employee break room. For employees that work in congregate settings, such as open manufacturing floors, warehouses, areas open to the public, shared offices, or similar settings, those workers shall wear a face covering as above, as well as when they are at their workstation. In addition, continuous wearing of masks is not required in outdoor workspaces where employees do not regularly come within 6 feet of other employees. If you work in a retail setting, the retail and mall sector rules state that employees must wear a face covering even when a plexiglass barrier is present. I would refer this individual that asked this question to the Reopen Connecticut sector rules for your specific workplace setting, and those can be found on the governor's COVID-19 webpage. So again, thank you all for your questions. I hope that these video segments have been helpful. In between our videos, if you have additional questions, please feel free to reach out to the health department. We can be reached at 203-630-4226. Thank you.